Well, thank you so much to the association and in particular Tracy for asking me to do this. A little bit higher. I'm extremely passionate about this issue, domestic violence fatality review teams and the prevention of intimate partner homicide. So I would do it at a drop of the hat, which is what I just did. So forgive me if I'm relying on my... Perfect. I'm maybe a bit too tall. I might have to take my shoes off. So forgive me if I rely on my notes at times. I haven't had as much time as I would like to prepare for this, but I'll do my best. So I originally became interested in the issues related to domestic violence fatality review teams when we did a study in 2000 on intimate partner femicides. I did that study with Jane Coombe, who's here today, Penny Bain, Randy Kropp, and Stephen Hart, who you heard from yesterday. And what we discovered in this study, similar to what Jackie Campbell's been telling us this morning, has been telling us for years, is that these occurrences are often very preventable and that we need to do things to try and actually improve our system response. So Jane Coombe and Penny Bain were actually the people that introduced me to domestic violence fatality review teams as one potential way of trying to increase understanding of these events and trying to change our system response to reduce their future occurrence. So that's what I'm going to be talking specifically to you all about today. Now, just to briefly review, because Jackie did such a fantastic job this morning talking about intimate partner homicide, I'm specifically going to talk about intimate partner femicide just with this first slide. So that's the homicide of a woman by her current or former intimate partner. That's what we focused on in the study that we conducted in 2000. Okay? So, as Jackie suggested, these are very common events. Approximately 30 to 60% of all women that are victims of homicide are killed by their intimate partners. And these are worldwide statistics. In BC and Canada, approximately 30%. And these statistics don't account for the number of individuals that are also killed within the context of these murders. So family members, children, new spouses, neighbors, other professionals. So even in that study where we looked at 13 intimate partner femicides from 1997, there was actually 25 deaths related to those homicides. Okay, so double the amount of deaths. So in many cases, though, unfortunately, these, or maybe even fortunately, these femicides are preventable occurrences because often family members, friends, service providers are aware of serious problems in the relationship prior to the homicide occurring. So as a result of the immense costs of these deaths, we actually need to identify ways to try to prevent or reduce their occurrence. So domestic violence fatality review teams actually emerged approximately 14 to 15 years ago in the United States of America and California. And since that time, they've grown at a rapid pace, and they've been established all over the United States, and we have one team in Canada, that's in Ontario. And they involve a collaboration of domestic violence-related stakeholders or professionals. And what they're trying to do is review cases of intimate partner femicide or homicides and identify risk factors or gaps in the system response. And the ultimate goal of these teams is often to try to make changes then to the system response to prevent their occurrence. Most of these teams do publish a report based on their work. So they summarize their work, their findings, and their recommendations for systems change. And they may publish these annually or biannually. And that's often the way that they try to actually make changes to the system response. The primary means is publishing these reports. So this slide here is just to give you a sense of how many states had active teams in 2006. That's when I started the study. What we're missing is Ontario, so the one province in Canada that had a team. And so right here, there's 28 states, they're the blue ones, that had an active team, were actively meeting and reviewing cases, but the number of teams far exceeds that. So some states may have only had a single team, but others had numerous teams across counties or regions. So say, for instance, California alone had 22 teams in 2006. And just to give you a bit of a context to this type of movement, domestic violence fatality review teams were really influenced by the development of domestic violence coordinating councils. That movement then influenced this movement. They are reminiscent of what we've talked about earlier in terms of reviews of plane accidents or mortalities in hospital settings. So I'll talk to you a bit about that process, but they've also been influenced by that type of movement as well. So since they developed, they have grown at a rapid pace, so 14 years, and that about approximately 75 teams in the United States. And very few have disbanded. So that, I really take that as an indication of the perceived need and effectiveness of the teams. And indeed, anecdotal evidence does suggest that domestic violence fatality review teams may lead to systemic changes. This includes increased public awareness or education about intimate partner homicides or domestic violence-related homicides, better coordination of services, and improved policies and procedures. Those are the general areas in which they've been shown to have anecdotal evidence that they might be changing the system response. However, due to their rapid growth, relatively little is actually known about the nature of these teams and what they accomplish. Okay? So that's where this study came in. So what I wanted to do is I wanted to conduct a study of these efforts to get a better understanding of what they looked like and what they were accomplishing. So I employed qualitative methods to sort of describe how they promote systems change. And I did that by trying to get a really in-depth understanding of what their goals were, what their structure is, their process, and then some of their outcomes. And then I also really wanted to get a sense of what the tensions or issues were underlying these efforts. And what I mean by tension or issue is that often teams face dilemmas or trade-offs, choices in the course of their work that have relative costs and benefits. And the reason why it's really important for me to understand these tensions is I had a sense that how people resolve these tensions had an influence on how the team was then structured and what they accomplished. Okay, so I was very interested in looking at both of those things. So these are the things I'll be sharing with you a little bit today. So in terms of my participants, 35 teams took part in the study, representing every state and province that currently had a team. So the average age was 6 years old for the teams. And then 42 members took part in the study. And most of them had been members on the team since the inception of the team. I didn't put any restrictions on what member would take part in the study. It was really based on who would be most familiar with the history and day-to-day operations of the team. And so as you can see, a variety of different members with different roles in the team took part in the study. And I also didn't limit how many members took part in the study, so as many members as they wanted to could take part in the interviews. So with respect to the methods that I use, this is actually quite important. I actually spent quite a bit of time doing something we call reconnaissance, sort of getting to know an area. So I consulted with experts in the field, like Peter Jaffe. He's an expert in domestic violence fatality review teams and domestic violence homicides. And then I attended a national conference that they held at that point almost on a yearly basis. And I really got a sense of where these teams were, who they were, what types of issues they were grappling with. And that really, I think, facilitated my ability to conduct this research with them by establishing relationships with them and letting them know how committed I was to this initiative. So what I actually did was I compiled a list of all the active teams. And lucky for me, there's the National Domestic Violence Fatality Review Initiative is a national clearinghouse for domestic violence fatality review teams and resource center. It has a wonderful website that if any of you are interested in fatality review teams, I would really encourage you to consult with, where it has an ongoing list that it maintains of all the active teams, and it keeps a lot of their reports there as well, lots of information about what they do and accomplish. So I conducted the sense of where all these active teams were, and then I wanted to select at least one team from every state or province that they currently existed to get a real sense of the geographical representation and diversity of those teams. And then again, as I mentioned before, I wanted to talk to at least one member who was familiar with the history and day-to-day operations. So 100% of the teams agreed to take part in the study, which is fairly good. So I think that was the perceived need of this type of work and how much they felt strongly about the work they were doing. So in terms of how what methods I used to talk to these teams and understand them, I conducted an in-depth interview. So it really was that, a very in-depth interview to talk to them about their goals, their structures, their processes, their outcomes. The interviews lasted about 2 hours via telephone. My mom thought I had perfect training for that because she could never get me off the phone when I was a kid. And then what I did is I conducted a document review. So as I talked about, most of them put out these reports every year or every other year. And so what I tried to do is I tried to get a copy of the most recent report that the teams put out. 89% of teams published reports at that time. So I tried to review that report and get familiar with the team before I conducted the interview. And then with respect to the analysis, I just conducted a combination of frequency analysis to get a sense of the frequency of events and content analysis to get sense of the themes. Okay, so in terms of the findings, well, it's just in a general finding, I was actually very surprised to see how diverse the teams were. And you'll get a sense of some of this diversity as we walk through some of their goals, structures, processes, and outcomes. So most teams, or all teams, had the following goals, or they fell within these categories. So wanting to change policies and procedures, wanting to promote awareness and education, improve coordination and relationships among services and service providers, and of course creating additional funding and resources. So what did differ between teams is how much they emphasized each of these goals, how important each of these goals was for the work of the team. Now, the structures of the team differed in some important and interesting ways. So when we're thinking about actually establishing a fatality review team, in most states there was a lot of people were nervous about getting together and sharing this information with one another. So by the time I spoke with them, the vast majority of them had been established under legislation or executive order. And the reason why they wanted to do that is that they wanted to take measures to actually protect the confidentiality of their proceedings, protect them from liability, and increase their access to information. So they were established very formally. 22% of teams were still established under an interagency agreement, so a less formal means of sharing information when either they didn't want to be established under legislation or they weren't able to be. And then the Coroners Act is in Ontario. That's how the team in Ontario is established. It's been established under the Coroners Act. Okay. And so what was interesting was that where one tension emerged is that even when these protections were put in place with respect to confidentiality, liability, access to information, there was still some tension within teams with respect to what information should or would be shared. Some services were very reluctant to share information, given that they hadn't received the victim's consent to do so, or they felt that it was a violation of her confidentiality. So that was a tension that did come up in some teams. And when I mean it was a tension, this is something that they had conflict over, they grappled with, and could have influence in terms of what they then decided they would share or could share. So this quote here is just one from a team that very much supported sharing information. I think we can really identify the issues that need to be addressed and help make significant improvements to the system by sharing the information honestly and openly within the group. Now, I think this conflict between information sharing is something that we grapple with every single day in the work we do, right? We're constantly thinking about who can we share information with? Will it increase risk of harm? Will it improve someone's safety? And there's constant barriers to this. So they also are sort of dealing with this on a different level, even when those barriers are removed. Okay. Now, another interesting thing about this structure, which you already would have had a sense of when I talked to you about how they were set up, is that 43% of the teams I interviewed were state teams. So it's a single team for the state or a single team for the province. So Ontario is a statewide team. Whereas 57% were county or regional teams. So where a state has a variety of different teams at a county level or a multi-jurisdictional level. They may or may not have an overseeing body, though, guiding their efforts, providing them with support. Now, the membership of the teams was quite consistent with respect that 100% of them included professionals. And when I mean professionals, I mean anybody involved sort of in the domestic violence movement, so that it could include domestic violence services, police, coroners, judges, prosecutors, batterers intervention program, mental health, hospital. So often it was as many people as you could possibly get together in the room where they might have been connected with either the batterer or the victim prior to the homicide occurring. Where teams differed is what professionals they necessarily had on the team and what sort of level that professional was within their organization, what level of power they often were. Whether they were service delivery or administration, that changed. And then where they really differed was with respect to how many of them included non-professionals. So victims of domestic violence, victims of near-lethal homicide, family members of people that had been killed. So this is where they differed, and this was a tension within teams. So what I felt might have been influencing this tension is that teams seemed to be structured based on, crudely if I'm going to say this, two models. One was a betterment approach that's referred to in community psychology literature, and it's where it's sort of a top-down model where powerful players are the ones influencing the team, guiding the team's efforts, so often at a state level. Whereas the empowerment approach is sort of that bottom-up level where teams might be based in a community and local service providers are the ones guiding the team, sort of guiding those efforts. So the community teams, the ones based on the betterment model, were much more likely to be supportive of including non-professionals on their team and to value their input. So certainly the inclusion of non-professionals brought up issues related to confidentiality, whether you might harm individuals like family members or victims. So those types of issues were very important with respect to what were the pros and cons of this. And sometimes they actually came across different ways of including victims or family members by conducting interviews with them, by giving them questionnaires. So including them in different ways as opposed to having them as a member of the team. So this is a quote from a team that actually felt very strongly about not contacting family members in any way. So we do not contact family members to ask them for additional information. We really hold true to the fact that our value of confidentiality is important, and I do not think we could ensure that if we included the family. Now, with respect to the breadth of the cases, that also differed. So when I introduced this presentation, I was talking about intimate partner femicides, which would be a very narrow definition of domestic violence-related homicides. So 43% of teams used a narrow definition. So they reviewed intimate partner homicides. So it could be the murder of a woman or a man related to domestic violence. Whereas 57% of teams use a much broader review of cases. So that could include any domestic violence-related death. So any death that occurred in the context of domestic violence. It could also include deaths that were thought to be related to domestic violence, such as women that die of AIDS or prostitutes that die. Okay, so very different in terms of their scope. The process they used to review cases also differed. So 91% of teams, the vast majority of them, use something I call a sort of a biographical approach. So it's a very in-depth review of these cases, where they're trying to get a sense of what risk factors were present, what gaps in the system response. So really wanting to get an in-depth nature of the complexity of these cases. So with those teams, that might be so in-depth that a team might only review 2 cases a year and spend 2 days on each case. Okay, so that's how in-depth it could get. Whereas some of those teams, and often they did both, would also use an epidemiology approach. Some of them only used an epidemiology approach. And that's where you do such a broader review of cases. Okay, so you want to get a larger number of cases to look at the trends across the cases. And teams would review up to 200 deaths a year, so that's as big as it could get. Now, the number of cases you review is directly related to the time you spend on it. So as I mentioned, the people that reviewed 2 cases a year spent about 2 to 3 days on each case. And the people that reviewed 200 cases spent about 4 to 10 minutes on each case. So you can think about how that might have implications for what you're discovering and what you do with that information. So tension did arise between the teams with respect to these 2 approaches. This is something that they did have conflict on. Should we take a biographical approach, or should we take an epidemiology approach? Because they certainly had both costs and benefits to each. So again, the proponents of the biographical approach thought that we really needed to take this biographical approach to get an in-depth understanding of these cases and their ability to understand the gaps in the system response. Whereas the people that emphasized epidemiology approach actually warned about ever basing any recommendations for system change on a single or a few cases. And they felt it was very important to rely on the trends across cases. So this quote emphasizes why people who thought they needed to take the biographical approach. Because domestic violence is such a complex issue, we really need to gather a lot of information and take an in-depth look at the uniqueness of each case. It gives you the opportunity to identify gaps and increase cooperation and collaboration. If you do not dig deep enough into a specific case, the likelihood that you're going to be able to identify these things is pretty slim. Now, right now, in terms of findings, I'm just going to be focusing primarily on recommendations, the process of making recommendations. Now, with respect to the teams, the vast majority of teams made recommendations. So 86% of the teams I spoke with made recommendations. And most of the ones that hadn't yet were in the earlier stages, so they all planned to do so. However, there were a few teams that actually warned against making recommendations, either because they didn't think it was their role or they didn't think it would be an effective way of promoting systems change. So let me just show you a quote here. It's an interesting perspective. So it makes it more difficult to have agencies change if we use the team as an agent for making policy recommendations. The result is the opposite of what you would like to get. People become more entrenched and unwilling to change because of feeling that something has been dictated to them instead of feeling that they themselves are agents of change. And this is from a county team. And then with respect to developing recommendations, teams actually use very different ways to go about developing recommendations. 23% of teams made recommendations based on specific cases. So they would review a case and then develop recommendations based on that case. 20% actually made recommendations on an aggregation of cases. So it could be all the cases they reviewed that year. They'd make recommendations on the basis of the trends in those. 3% were non-specific, so they just made general recommendations, sort of free associated to the case. And 54% used a combination of these approaches. Now, tension actually arose within teams with respect to how recommendations should be made. So some teams felt like it was very important to tie the recommendation to the case because that was their way of establishing the neutrality of the case and respecting the victim. Sort of even they argued that it was their way of maintaining their credibility as a team. Whereas other people thought, similar to the epidemiology approach, it was very important to tie recommendations to trends across cases, and that we need to look at patterns. People felt very strongly about both ways of doing this. And this quote emphasizes the importance of linking the recommendations to the specific case. Unless you provided the specific case and the specific recommendation, it would only be a recommendation without a context. Now, with respect to the outcomes and the types of recommendations that were being made, again, these are very similar to the goals of the teams. So not surprisingly, the recommendations they make, and hopefully, are reflective of the goals. So 100% of teams actually made recommendations with respect to changing policies and procedures. 89% made recommendations with respect to promoting awareness and education. So that could be general education of the public, increasing training. 71% were interested in making recommendations about improving coordination and relationships. And 68% were interested in making recommendations or did make recommendations related to additional funding and resources. Now, tension actually arose here with respect to how targeted recommendations should be. So just to give you a sense of the context, a lot of domestic violence fatality review teams, or the vast majority of them, were established under a philosophy of no blame or shame. They felt that it was important to have people come to the table, feel comfortable, and share information, that they need to endorse this philosophy that people no individual or agency would be blamed or shamed for this fatality. However, some teams found that as they started to review cases and they started to find clear gaps in the system response, that the no blame or shame philosophy might have sort of tied their hands behind their backs with respect to making those targeted recommendations towards specific agencies or even individuals. So sort of that tension between should we hold people accountable or the no blame or shame. Of course, that's a very concrete way of looking at it. A lot of teams argue you could do both at one time, but certainly this was a tension. So one of the quotes that came up that was really emphasizing the importance of targeted recommendations is one member from one team said, you can make all the recommendations in the world, but if they're not looked at by people who have the ability to change policies and procedures, then you're just creating something for the shelf. I think some people could resonate with that. And the last finding I'm going to talk about is with respect to implementing recommendations. So implementing recommendations, almost, I guess, obviously maybe, to all of you, I think, appeared to be the most powerful step in the recommendation process with respect to trying to change systems or promote systems change. However, only half of the teams were actually involved in monitoring whether the recommendations they made were implemented, and 46% of teams were actually involved in implementing the recommendations themselves. And far fewer published the actions that were taken. That's starting to become a very popular thing. And 6% published an action plan in advance, so in their reports informed people about how they were going to hope to carry out these recommendations. Now, tension actually arose within teams with respect to how involved they should be in implementing recommendations. So this really came back to what those teams really thought the goal of the team was. So some teams really thought their goal was to increase understanding of intimate partner femicides, understanding of the gaps in the system response, and make recommendations to other people to then implement. Whereas other people thought the goal of the team was for action. So they felt it was their responsibility to actually make systems change, to help to implement, monitor these recommendations that they were making. So where teams fell on that had a huge implication for respect to what they were doing with respect to implementation there. And this quote here sort of challenges the idea that change will take place if you just try to increase understanding. So the team never expected to have to follow up with implementation of recommendations. It learned, however, that its efforts were futile otherwise. And that was from a team that actually then did do a review to see what changes had been made in their community, and were quite devastated to find out that none had been. So, in summary, I hope these findings have shown to you sort of the diverse nature of fatality review teams and how these tensions are so important for influencing this diversity. And it's also, I really want to start to highlight how some of these differences might have implications for how effective they are at promoting systems change. So therefore, I think it's very important for these teams to start to evaluate what their role is in implementing or promoting systems change and how effective they might be in doing so. So the following are some tough questions that teams reported that they felt like they needed to start answering. What are we accomplishing? Is it worth the time, resources, and energy? And how do we compare to other prevention efforts? So from a personal perspective, I think that in this room we probably all agree that every domestic violence fatality deserves for us to understand what happened and how we could have prevented it, right? So I don't think the question in BC is whether we should establish a team. I think it's how best we can establish a team to increase our understanding of these events and prevent their future occurrences. Well, thank you so much.
I just want to say thank you again to Kelly Watt for that very informative presentation, and I'm sure that it will help her. The work she's done will really help us move forward in hopefully developing our own death review committee in BC. That's certainly one of our dreams. Okay, we're going to do some door prizes quickly, and we have a few announcements. And then we have the big door prizes. Okay, I'll do the announcements first. If workshop presenters could go to their rooms a little bit early,